At any one time, probably about 5% or maybe even up to 10% of the American population has back pain. In a lifetime, though, it's well over 30% of the people will have back pain severe enough that they need to seek medical care or will miss work because of it. Traditionally, we use icing for acute injuries or injuries that just occurred. For individuals that have stiffness and soreness the following day or two after an injury, oftentimes heat is better. There's a very strong individual preference. Most individuals will like to use heat early in the morning if they're stiff and they're sore. After a day, though, or if they've been on their feet for a while, many times ice is more comfortable. Icing reduces swelling, decreases muscle spasm, and allows an individual to move more freely and easily. Heating will loosen up tight joints, will also loosen up tendon and ligaments surrounding joints, and oftentimes will eliminate some of the stiffness and soreness associated with more chronic conditions. Compliance is always a challenge when it comes to patients and fitting it into their busy daily activities, especially with ice or heat, because they take time to apply. Oftentimes you can't move when you have the ice and heat, and sometimes you're tethered to an electrical cord. In the office environment, it's almost impossible to apply them in any way that's not messy or cumbersome. Yes, not only do you want to have a person engage in normal activities, it's been shown that the healing time is less if you do so. So if you can make a person more comfortable while they go through their daily activities, oftentimes the healing time is less. Well, the obvious answer is the size of the area of application. The area that can be covered is much larger than on a simple wrap. It's also very user-friendly when it comes to how you can wear the device, how unobtrusive it is. Many people don't want to be answering questions 4 or 5 times a day. Why are you doing this? What are you wearing? And as I mentioned earlier, it's very easy to apply and to be on the go, so you don't have an interruption from your daily activities. The advantage I see with Spandice is that it lowers the barrier to compliance. It gives you a higher threshold of safety, and it also removes a barrier of acceptance in social environments and work environments. I also see it being used routinely for individuals with chronic conditions, those that have had surgery, those that are trying to avoid surgery. It's a way of managing your pain without being incapacitated by your pain. With Spandice, you have a measure of safety because the delivery system has only so much thermal mass. Unlike a heating pad, which continues to generate heat without stop, with Spandice device, you do not have that risk. Spandice also has a nice layer of protection, so you don't get the cold applied directly to the skin and incur a frostbite or another an ice thermal injury.